morning. I'm called to order the special Grande Prairie City Council meeting for Wednesday, March 18th. I would look for a motion from council that the required number of attending council members to achieve a quorum, with the exception of the chair, may attend via special council meeting teleconference. Councillor O'Toole, can I get you to make that motion to allow this meeting to continue using our electronic means? Councillor O'Toole?
Okay, thank you, Mayor. Thank you, Mayor Gibbon. I move that the required number of attending members of council to achieve quorum, with the exception of the chair, may attend the special council meeting via teleconference.
Okay, thanks very much, Councillor O'Toole. We do have technology. We don't use it this way all the time, and so we may go through some bumps as we implement this, but that's all right. We have different ways of doing things, and we're going to use them. In terms of voting, we don't have the ability for people to vote remotely and display that on screen. So I'm going to ask for all in favor, and then I will ask for any opposed. If we hear that there is no one opposed, we'll take that as a unanimous consent. If there is someone opposed, then we would go through and just sort of get name by name so we can record that appropriately. So we'll try that process, see how it goes. Councillor O'Toole, on Councillor O'Toole's motion, which essentially just allows this meeting to go forward. All in favor, just say aye.
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 Okay. Any opposed? Okay, I hear none opposed, so we will take that as a unanimous motion. That one worked. And so, as everyone knows, this meeting is to receive an update from our City Manager and Director of Emergency Management with respect to the City's response to the COVID-19 pandemic. I'm going to turn it over to Horacio right now. Again, Council, if you're on the line, please make sure that your microphone is on mute so everybody isn't getting any feedback, and so everybody can hear Mr. Galante's presentation. Horacio, I'll turn it over to you.
Okay, thank you, Mr. Mayor, and good morning, everybody. I will provide a situational report about the COVID-19 outbreak and a recommendation at the end of my presentation for Council. So a pneumonia outbreak was identified in Wuhan, China on December 31st, 2019. On March 11th, the World Health Organization declared a pandemic globally. The Provincial Operations Center elevated to operational level 2 on January 30th to support the Alberta health response to COVID-19. Due to the widespread nature of cascading effects impacting the public, multiple municipalities, and the economy across Alberta, the Provincial Operations Center elevated to operational level 3 on March 14th. Due to the declaration of a state of public health emergency on March 17th, the Provincial Operations Center elevated to operational level 4, as the highest level, yesterday, March 17th. In terms of municipal context, municipalities and First Nation communities, as well as private industry, continue to take local action in response to the COVID-19 outbreak in the province. Yesterday, 12 additional emergency operations centers have activated, bringing the total to 5 provincial, 42 municipal, and 4 industry. 7 states of local emergency, or SOLE, have been declared in the past 24 hours, with a total of 9 in place. In terms of the provincial context, yesterday afternoon, Premier Jason Kenney declared a state of public health emergency. The following announcements were made yesterday. Alberta has announced 23 new cases yesterday for a total of 97. There are 3 cases in the Alberta Health Service North Zone. Mass gatherings are now limited to no more than 50 attendees. This includes worship gatherings and family events such as weddings. However, grocery stores, shopping centers, Healthcare facilities, airports, the legislature, and other essential services are not included. To limit the amount of time Albertans are spending in large crowds and crowded spaces, all Albertans are prohibited from attending public recreational facilities and private entertainment facilities, including gyms, swimming pools, arenas, science centers, museums, art galleries, community centers, children's play centers, casinos, race and entertainment centers, and bingo halls. Sit-down restaurants, cafes, coffee shops, food courts, and other food serving facilities, including those with a minors allowed liquor license, are limited to 50% capacity to a maximum of 50 people. Takeout, delivery, or drive-through service is permitted. Licensed facilities will also be permitted to deliver liquor. At this time, not-for-profit community kitchens, soup kitchens, and religious kitchens are exempt, but sanitation practices are expected to be in place, and support from the province will be in place for this practice. Until further notice, all Albertans are restricted from attending bars and nightclubs where minors are prohibited by law. The City of Grande Prairie operates in an emergency situation as part of the Grande Prairie Regional Emergency Partnership, or GPREP. GPREP has a very experienced and highly trained team of emergency management professionals working toward preventing and mitigating the impact of the COVID-19 virus in the region. The unique situation of the City of Grande Prairie, with a population of 70,000 people in a relatively dense urban area, and its QA2 hospital, as a referral center for a catchment area of more than 250,000 people, demands rapid actions to further prevent the spread of this virus. Analyzing statistical information about the evolution of the spread in mainland China versus the rest of the world, it is clear that here in Canada, we are at the beginning of the curve, and therefore in a unique position to contain the spread more effectively. In order to do that, we need to take rapid decisions to safeguard our population, trying to flatten the curve as much as we can. A declaration of a state of local emergency is one of the tools available to municipalities to monitor and enforce the provincial restrictions in terms of social distancing. It gives municipalities broad powers to act on short notice and to react and adjust plans as needed based on the very dynamic circumstances of this event, with multiple inputs received from multiple sources in short periods of time. This will be a long-duration event. The current models are forecasting the spread to peak in about 8 weeks. Enforcing strong social distancing measures is critical to contain the spread. The GPREP team is working together with community and regional partners, assuring long-term, stable, and predictable food and water supplies to the region. We are in constant communication and exchanging information with Alberta Health Services, the Grande Prairie Airport, all utility companies, and all supermarkets in the region and other essential service providers. The City of Grande Prairie has activated its business continuity plan in order to secure the continuity of core services to our residents, and our local government will continue operations using a variety of technology to avoid disruption as much as we can. Our efforts are focused on supporting Alberta Health Services. The ultimate goal is the preservation of the health system capacity. And I will repeat this again. The ultimate goal is the preservation of the health system capacity. So if we have cases of critically ill patients, the health system will have enough resources to to properly manage them. And I'm not only talking about the hardware like ICU beds or ventilators, but also the human resource component, nurses and doctors and technicians. These early actions at this stage are considered an investment that will pay big dividends in the weeks to come. Strong social distancing measures are critical at this stage, and under a SOLE, the city will have the authority to act at a moment's notice if needed. For all the reasons expressed in this situational report and in my capacity as Director of Emergency Management, I recommend City Council to declare the state of local emergency for the City of Grande Prairie effective immediately. Thank you, Mr. Mayor.
Okay, thank you very much, Horacio. I will let Council know that I concur with the City Manager, Director of Emergency Management's recommendation. I think do have an opportunity for Council if they have questions for Horacio. Horacio, you're prepared to answer questions of Council. And so, Council, I appreciate that it may be challenging to put up your hand if you're on the line, but what I will do is I will go sort of around the horn and ask if there are any questions of each individual Council member, and if they are, then certainly you can ask them. Horacio will do his best to answer them, and I just would sort of acknowledge up front that things are changing pretty rapidly, and the City of Grande Prairie is not the source for health information. Alberta Health Services is the best source for health information, and so I just would sort of put that context to make sure the Council appreciates what Horacio may and may not be able to answer in terms of what information might be available at hand today, or where we're best placed to answer. But that being the case, I'll start just at the top of my list, and we'll do it alphabetically. Councillor Blackburn, do you have any questions for the City Manager?
Yes, I do. Thank you. I'm in support of the recommendation, and one of the things that occurs to me is how difficult it might be to deal with social distancing for the homeless, and I wonder if there are plans in place or at least being contemplated that would include those people.
Mr. City Manager?
Thank you, Mr. Mayor. Yes, that is correct. There is a specific plan in the works right now, and we have constant communication with Rory House and other supporting agencies in town. That is the information I can release for now. There will be an assessment center for everybody at the Ernie Radburn Pavilion that has been confirmed as well with Alberta Health Services, and the facility is available as a test center, and if required. But in terms of maintaining core services, transit services is one of the services that we will maintain as core function to mobilize people in low income, and the homeless population is being monitored as well actively via census and securing continuity via food bank. And we're checking levels with food bank. We did that yesterday, and they are okay. And there are many community groups as well helping us in this regard. Thank you.
Thanks, Mr. City Manager. Councillor Blackburn, did you have anything further?
No, thank you.
Thanks, Councillor Blackburn. Councillor Bressie, did you have any questions?
Yeah, thank you, Mayor Gibbon, and thank you, City Manager Galante. I appreciate the work that your team are doing, and I'm in support of your recommendation right now. But my question is, I understand if we declare the state of emergency that things are completely in yours and staff's hands for rapid response and for continuity operations and all that, which I'm thankful for. I'm glad we've got your team, but I'm getting a lot of questions about financial measures to help struggling businesses and struggling families that are impacted. And I'm just curious, what's the plan in terms of council having those financial discussions in the next couple of weeks to help people know how we're going to help them out?
Mr. Galante?
Thank you, Mr. Mayor. In a conference call with the Provincial Operations Center yesterday afternoon, all municipalities and responding agencies, we were instructed to track all expenses related to the event. So we're doing that. We have activated our finance section on our Emergency Operations Center. We created budget code specific for this event. So we're tracking everything. And the intent from the province is that at some point in the near future, there will be some sort of financial package. At that time, yesterday, the information was clear that no promises made, and that was repeated several times from the provincial level, and they are in constant communication with the federal level as well. But they instructed us to track everything in case that in the near future there is a possibility to submit all expenses related to this response for a potential financial package coming from higher levels of government. So I don't have right now an answer in terms of this because it's beyond municipal control, but there are conversations at the provincial and federal level.
Thanks, Mr. Galante. And Councillor Bressi, you may have also seen, and you know, it's last night the media were reporting that the federal government is considering an aid package for Canadians. We don't know the shape of that. The numbers that I was reading last night was that it was a $20 billion package. But again, that
27.
So that type of support would come from the federal government to this stage. Council may have an opportunity to discuss what we might wish to do locally as we move forward. Councillor Bressi, anything additional?
Nope, that's good for me. Thank you.
Thanks, Councillor Bressi. We'll go to Councillor Clayton. Councillor Clayton? You'll have to get your microphone, Councillor Clayton.
A question in regards to timing. I know the provincial medical state of emergency is 30 days, and from there can be extended. Tell me what the time frame looks for. Is it same sort of time frame or how that works?
Mr. Galante?
Thank you, Mr. Mayor. In terms of our local declaration of state of local emergency, the validity of this declaration is for 7 days and can be renewed for extended periods every 7 days.
Great, thank you. That's it for me, thanks.
Thanks, Councillor Clayton. Councillor Friesen, did you have any questions for Mr. Galante?
I do, thank you. Thank you, CEO Galante. I appreciate your requesting this at this time, and I just want to clarify, I guess. So our ultimate goal is, of course, relieving stress or on the healthcare system. But how we do that then through declaration here is it gives us just a little more teeth into the recommendations that have already been made federally, provincially, and locally. Is that fair to say? We would be able to make sure that people are closely following those?
I think we got that question, Councillor Friesen. Mr. Galante?
Thank you, Mr. Mayor. That is correct. Under a state of local emergency, the municipality has broad powers to enforce the social distancing measures imposed by the province. We have a set of measures. I referred to a few of them in my briefing. So we will be able to deploy RCMP or enforcement officers to monitor, to check the compliance in terms of restaurants, bars, churches, places where we need to contain the spread via the 50 people rule right now. The rule may change rapidly, but we have the ability to quickly deploy resources at a moment's notice. Thank you.
Okay, I just wanted to confirm that. And then how does it add to or change or shift what we're doing to maintain our fairly essential services like our garbage removal, for instance? How does doing this enhance our ability to make sure that we are providing what our residents need in order to continue to stay healthy?
Mr. Galante?
Thank you, Mr. Mayor. That is part of our business continuity plan, and we are closely working with utility companies, in this case with Aquaterra for garbage collection and water and sewer treatment. The same with ATCO Electric, ATCO Gas, and supermarkets. So that's part of our business continuity plan for city core operations. The extra authority under SOLE is that we can instruct private contractors to help if needed in terms of garbage collection or so. That is pretty much the extra authority we will have under the state of local emergency. Thank you.
Okay, all right. Thank you very much. That's good for me, Mayor Gibbon. Thank you.
Thanks very much, Councillor Friesen. Councillor Minhas, did you have any questions for Mr. Galante?
Oh, it's my turn already. Yes, I do got a couple clarification when you said 8 weeks. That's when we got 8 weeks because provincial is 30 days, and you said mentioned. Can you clarify that part?
Sure. So,
and,
Councillor Minhas, just to sorry, maybe we'll just make it one question at a time. So, Councillor Minhas, your question was with respect to Mr. Galante's reference that the peak of this event is likely to be in 8 weeks. Is that what your question was? Yes. And just comparing that to the 30 days that the province announced. Mr. Galante, do you want to speak to that?
Okay, thank you. Yes, the validity of the different states of emergency, in this case, the public health emergency declared by the province, that is a different set of authorities compared with the state of local emergency. They have different durations. However, statistical calculation, when we compare the evolution of the spread in mainland China versus rest of the world, you will see 60 to 90 day exponential growth on the curve and then flattening. So in Canada at this stage, we are on the first month of the curve. That is the reason that in the US and Canada and pretty much the rest of the world, you're seeing exponential growth in the spread because of the first month on the curve. And the calculations are giving us an 8-week time to peak the spread with a strong social distancing measure. So that is the critical part at this stage. We're at the beginning of the curve, and it's a big opportunity to control the spread and to flatten the curve as much as we can. Thank you.
Oh, thank you. The second question is, you mentioned the kitchen soup and the churches, they are allowed to get people together over 50, their limit is 50, or they can't, they'll be separated.
Thanks, Councilman Huss. So a question on religious assemblies and separately on soup kitchens and homeless.
Thank you, Mr. Mayor. Worship gatherings are restricted to 50 people as today. So churches, no more than 50 people. In terms of soup kitchens are exempt at this stage, but with strong sanitation practices, and the province has some guidelines in terms of how to run the operations. Thank you.
Okay, the churches, 50 people, can they provide the food there or no?
Do you have
Yeah, I have more details. So I will read this section again. So at this time, not-for-profit community kitchens, soup kitchens, and religious kitchens are exempt.
So, Councilman Haas, I think the answer to that is that that faith-based community-serving kitchens are exempt from the 50-person limit, but they should be enacting very strong hygiene and sanitation measures. And that's under the provincial rules announced yesterday. Anything further, Councilman Haas?
Yes, can I say something? Like I was listening to federal Prime Minister's speech this morning. They give $27 billion to the personal and $55 billion to the sport, to the business. So what I heard was saying, like, the people don't have UIC and unemployment insurance thing. They will supply every 2 weeks the checks, and also they talk about those homeless people, and the federal support is coming. I don't know what he said. Next few days they're going to figure out how they're going to deal with it. So that was a very good thing from the federal government coming out. And I'm supporting this emergency thing, so I'm okay with it.
Okay, thanks very much, Councillor Minhas, and thanks for sharing that updated information. As we noted, things are moving rapidly, so I appreciate you providing that update. We'll just make sure that anybody that had their lines open puts them back on mute, and we'll go to Councillor O'Toole for any questions. Councillor O'Toole?
Yes, thank you very much, Mayor Given. I'm totally in support of the motion when it comes out. But I was just wondering about home-based businesses like the hairdressers and other occupations that have people dropping in on a regular basis. How is that affecting them?
Mr. Galante?
Thank you, Mr. Mayor. At this time, there are no restrictions in terms of small businesses like hairdressers, small shops, as long as they don't have more than 50 people inside the shop.
Okay.
Thank you.
Okay. Thank you very much, and thank you for all the work you've been doing and the crew that you have working with you.
Okay. Thanks, Councillor O'Toole. Councillor Palat, any questions?
Thanks, Mayor Given. Thanks, Director Galante, or City Manager Galante, for that. Appreciate the update, and it was something I'll be in full support of. I did have a couple questions. I'm just wondering if you can update us on what this looks like for grocery stores. Obviously there's a lot of panic on grocery stores, but I'm not hearing anybody say there's been restrictions to different grocery stores they went to. Just wondering with this, if we're now allowed to start putting restrictions on food services from the grocery stores.
Galante?
Yeah, thank you, Mr. Mayor. That's a very important point. I want to bring calm to the community in terms of food supply, because we are monitoring on a daily basis, and we have direct...
I'm just going to bust in really briefly. Council members that are on the phone, please make sure your phone is on mute, just so that everybody gets the benefit of hearing Mr. Galante's response. So just check to make sure that your phone is on mute if you can, for those council members that are calling in. Mr. Galante.
Okay, thank you, Mr. Mayor. So we have direct line of communications with all supermarkets in the region. They are reporting stock levels on daily basis, and not only stock levels in town, but also we are checking the hubs in Calgary and Edmonton, the stock levels there in terms of distribution. Usually the food trucks come to town once or twice a week to resupply. So at this time, we are monitoring very carefully. This is one of the key priorities for us, is water provision and food provision for town and shelter. So at this stage, we don't have any concerns from the main grocery stores in town. Again, there are no restrictions at all in terms of number of people there, just for everybody, typical recommendation. Keep the social distance when you do grocery shopping. Under the state of local emergency, we have the authority to assure adequate provision of food for everybody. Informally, some establishments here in town, they are monitoring the stocks on some items, and they are at the till recommending people not to take more than X number of units. This is currently being done informally on an informal basis. This is a good social responsibility that they're exercising. Under a state of local emergency, we will have the authority, if we see some articles going too low, to enforce some measures to, again, be sure that there is a stable, long-term provision of adequate food for everybody.
Thank you for that. Just one other question. It was kind of brought up a little bit earlier about the financial discussions. I'm just wondering, I know there's a lot, this isn't maybe the priority right now with health being more the priority, but if you can give us an idea of when we will be having a conversation as council about financial options that we can provide the community.
Mr. Galante.
Thank you, Mr. Mayor. The situation in terms of financial support is evolving rapidly. We are working with two different scenarios in terms of emergency planning. The first horizon is about 3 weeks. We are at the end of week number 1. The second horizon is end of May for planning purposes. So 2 months from now, 8 weeks. So we are waiting at this stage to see what the province and the federal levels of government may decide in terms of process to provide financial help for different segments of the society. It could be small businesses, could be particular vulnerable groups of the community. So for now, we are in the acute emergency response for the first 3 weeks. And after that, we're going to enter into more long-term mode, and financial stability will be a top priority at that time, as soon as we have water, food, shelter secure for everybody. So in order to answer your question for now is, we're monitoring with the province and the federal government and working with them, and we're ready to deploy any process. We have a special team here working on critical and vital systems, that we call, and that team will be in charge to design at the moment's notice any process, any distribution, any connections needed to execute any plan that may come from the provincial level or the federal level to rapidly deploy resources in terms of financial assistance to the different groups in the society. Thank you.
So I guess for me, it's good to hear that that's what's happening. I guess for me, there's a little bit more urgency than waiting for 3 weeks. I think our community is hoping we're going to give them an answer sooner than that. So I'm not sure what we can do about that as a council to put out some sort of message on that. I know that it's going to be great that the province and the feds are doing what they're doing, and they have the best ability to do that. I do think we have the ability, the city, though, to be playing our part. I'm just concerned that 3 weeks from now is maybe not quick enough for people to hear some good news from the city. So I'm just, I'm hoping we can have a conversation sooner or later about that, but I'll leave it at that, and I appreciate your update.
Thanks, Councillor Plott. Councillor Thiessen, I appreciate your patience. You just have the bad luck to have a T at the start of your last name. Councillor Thiessen, did you have any questions for Mr. Galante?
I do, and maybe it's the good luck in the elections. I'm usually the last one that people see before they decide to check their box. Actually, Councillor Plott took one of my questions, so that's good. I'm in full support of the motion of declaring a state of local emergency. I have one question, though, just in regards to the Ernie Radburn Pavilion testing site. Maybe I missed it, but do we know when that will be active, and what kind of plans do we have to mitigate long lineups when the site is active?
Okay, thank you, Mr. Mayor. We don't have a date or a specific time for Alberta Health Services to mobilize the site. For now, we have secured the site for them. There are no other commitments. The site is available. Again, at the moment's notice, they may issue a communication, and we are ready to surrender the facility to them to act. In terms of queuing management, that is Alberta Health Services protocols, how they're going to limit, again, to contain spread. You don't want to have 150 people waiting together. So that is part of the mitigation plan and control plan from Alberta Health Services. We will be able to support them with our resources, even if we need to deploy RCMP or enforcement officers to control crowds, no problem, but they will establish the queuing management at the pavilion. Thank you.
Councillor Thiessen, any other questions?
No, that was good. Thank you very much.
Okay. So we've gone around the horn. I'll give one last opportunity if there's anybody that appreciate that cycle took a little while. I'll just, if there's anybody that had anything additional that they'd like to ask. Councillor Clayton, you had something additional?
Thank you, Mayor Given. Along the original question I had in timeline, so 7 days from now, I'm assuming at day 5, whatever it is, you're going to assess if there needs to be an extension. Just sort of a question on process. Does that mean council gets back together again, has another vote on another 7 days, or how's that process?
Mr. Galante?
Yeah, thank you, Mr. Mayor. Because this will be a long duration event, we will probably come up with a different set of timelines, or we can expedite the process via a quick vote, electronic or so. We need to think a little bit about that. The decision to move into the SOLE was taken yesterday. after several communications with Alberta Health Services in order to preserve the ICU beds and the ventilators and the resources at the hospital here. So again, my apologies. It's a very dynamic situation, and we take many decisions with information that is very limited for many people, and it's a tough spot to be. So the extension of 7 days, we'll try to expedite that and make it easier, but I envision a longer-term duration of the state of local emergency. Thank you.
Okay, thanks, Mr. Galante. Was there anyone else that had any further questions?
Yes, me. I have. Are we going to have a regular council meeting, or that's going to be just like weekly, what we do now?
Thanks, Councilman Hostin. So the question was about regular council business and council meeting, and I'll answer that. The City of Grande Prairie continues to operate. Local businesses continue to operate, and our local government will continue to operate. We will have a council meeting. Obviously, the agenda will be, significantly changed, but administration is already looking forward to sessions where we may have had public hearings scheduled, and they're making contingency plans for how we will be able to continue to have those public hearings and continue council business. So yes, Monday, March 23rd will continue to be a council meeting. Agenda will go out for that as it regularly would. We will be implementing technology so that we can do this remotely. Ideally, we'll get to a point where we could have everybody on video, but we're going to work on that. But yes, there will be a council meeting on Monday. Yes, an agenda will go out as it regularly would, and council members should expect to participate in that in some measure.
Thank you.
One last opportunity. Okay. Thank you, Council. Thank you, Council members on the line being willing to participate this way. So we do have a recommendation from Horacio as our City Manager and our Director of Emergency Management. And the phrasing of the motion that's recommended by administration is that Council declare a state of local emergency for all of the City of Grande Prairie as a result of COVID-19 medical crisis pursuant to Section 21 of the Emergency Management Act, effective immediately. And so I would like to ask a council member to make that motion. Councillor Clayton?
So moved. Thank you.
Okay. Thanks, Councillor Clayton. So I will ask for all in favor, just by a verbal vote.
Aye.
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 Aye. Thank you. Is there anyone opposed? Okay, so we'll just confirm that that was a unanimous vote with our City Clerk. I believe that concludes all of our business for this morning. Thank you, Council, for the flexibility in setting up. We will, media were following in on the line, I believe. We will have some media availability following this. And Council has noted we will have a regular Council meeting on Monday. And so we will all continue to keep in touch as we have been over the next little while. And I would just encourage the community, one, to appreciate and recognize that we do, as outlined by the City Manager, have the systems and people in place to ensure that our community continues to run. And I would encourage people to take care of one another and check in on friends and family, but to acknowledge also that we do have to be doing things differently during this time to prevent the spread of the virus, so that we can allow our health system to have the capacity to continue to serve everybody's needs. That's the ultimate goal here, and it means that things will be different for a while, and that's okay. And in fact, if we can keep it different, it helps keep everybody safe. And so we should all be doing our best to do that. So again, thank you, Council, for your flexibility. We'll adjourn our meeting. Thank you.
Thank you. Thank you.
Thank you.